I'm Betsy Pilan. To all of you that are joining us right now. Is everyone, yep. Hannah and Adam, are you good?
Yes.
Okay.
Ready, thank you.
Great, wonderful, all right. It just started streaming, so I want to welcome everyone to our first kickoff during Infantile Spasms Awareness Week. I'm Betsy Pilan, I'm the president of Hope for HIE, and I'm joined today with two incredible practitioners. And so Drs. Hannah Glass and Adam Numis, if you want to introduce yourselves and tell us a little bit about your clinical work and expertise, and we'll get going.
Sure. My name is Hannah Glass. I'm a child neurologist and specialize in newborn brain injury, so neonatal neurology. My clinical and research practice is at University of California, San Francisco. And I have an active clinical program of specialized neurocritical care in the nursery and in the follow-up clinic. And then I also have an active research program to study causes of brain injury and long-term developmental outcomes, including infantile spasms and epilepsy. Glad to be here.
Thank you, Hannah.
Yeah, and I'm Adam Numis. I'm a child neurologist. I work with Dr. Glass, also at the University of California, San Francisco. And I'm a child neurologist that specializes in pediatric epilepsy. And specifically, my clinical practice takes care of mostly infants, babies and infants with epilepsy, in particular kids with infantile spasms. And clinically, we have a program at the University of California, San Francisco that specializes in the care and management of children with infantile spasms. And my research interests are both within infantile spasms and why some kids develop them, others don't, and how we can best treat children with this particular type of epilepsy.
Great. And thank you so much. This opportunity also has been provided, made possible by the Child Neurology Foundation. So I just want to give a shout out to them as well, making sure that we can have the tools and resources as well to do educational events like this. So thank you to them. So I guess, we're here this first event to talk about what is infantile spasms.
Yeah, so thanks again for having us. So infantile spasms are a particular type of epilepsy, and epilepsy really, it just means that someone has a tendency towards seizures. So once you have more than one unprovoked seizure, you have epilepsy. Unprovoked means it's not related to alcohol intake or low blood sugars. So epilepsy itself is just a tendency towards having it. Infantile spasms are a very particular type of epilepsy, and it typically affects children under the age of 2, with the age group most affected between 3 and 9 months of age, which is why it's so great to be talking with you in your community, because a lot of children in this community are at risk for it. It has a number of causes, and it is rare. It affects about 2,000 to 4,000 infants a year in the United States. Now, some children with infantile spasms will be diagnosed with what we call West syndrome. And West syndrome is a combination of infantile spasms, developmental delay or regression, and a particular pattern on an electroencephalogram, or EEG. And that's a test we use to look at the brainwaves of a child to characterize someone's epilepsy. So while not everyone with infantile spasms has West syndrome, everyone with West syndrome has infantile spasms. And again, this particular disorder again really happens in this particular developmental window, most commonly between 3 and 9 months of age, but almost always before 2 years of age.
All right, that's really helpful to know. I know we have a lot of families who, definitely question, their child's movements and things like that. So what does IS typically present like in kiddos?
Yeah, so most commonly the spasms look like a sudden bending forward of the neck with raising the arms. It's like a sudden shock through the body. And if you'll bear with me, I'll pull open a video that shows some nice examples of these. And what you notice is that the spasms tend to occur in clusters. That means that there's many in a row. And often parents notice that these happen just as the baby wakes up is a very common time for these to occur, but they could happen throughout the day. The movements might be more on one side or the other, or they might be very symmetric. And because they come in clusters and there may be many clusters per day, these can add up to hundreds of spasms per day. And the important thing to remember is that sometimes caregivers will mistake these for a common condition like reflux, but it's important to be alert and aware for them. So now I'm going to share my screen. I hope you can all see. I'm playing a video, and this comes from the Child Neurology Foundation. And here's some examples of infantile spasms. So you see the baby has this sudden stiffening, is alert and aware in between, but has many clusters, several in a row in a cluster. This baby was crying in between, which can also happen.
And we'll link this video as well in the comments if you guys want to take a look afterwards as well.
Great, thank you.
Yeah, so definitely something that our community does see. So what causes infantile spasms?
Yeah, so as Adam alluded to, there are many different causes of infantile spasms. And in fact, there are so many causes that we haven't discovered all of them yet. So in about a little more than half of the cases, we find a specific cause. And it turns out that HIE is a very well-known cause, but it's actually fairly rare. Only about 6% of cases of infantile spasms are due to HIE. And then when you talk about kids with HIE and how commonly they have spasms, that might be anywhere from a few percent to up to 30% of those children. And the number probably depends a little bit on how closely children are followed and how severe the HIE was and what type of reporting was done. But the important thing to remember is that most kids with HIE don't have infantile spasms. There's a number of other important causes, so other types of early brain injuries like strokes or low glucose causing brain injury or bleeds or preterm birth and injury. Abnormalities of brain development, probably families might have heard of tuberous sclerosis complex. That's one of the most common causes of infantile spasms. Other types of brain malformations or differences in brain development can also cause infantile spasms. And then there's a large number of genetic conditions. Probably the most common that people are familiar with is Down syndrome. Now, a lot of people ask, how will I know if my child will develop infantile spasms after HIE? This is a very active area of research. The main thing, again, is that most children do not develop infantile spasms. But if the clinical course was very severe, for example, there were a lot of seizures in the neonatal period, or there was severe brain injury on the MRI, then we know these are the children we need to watch the most closely because they're going to be at the highest risk of infantile spasms.
Thank you. So we kind of went over what infantile spasms looks like. And so I guess the next question is, Adam talked a little bit about it, but how is IS diagnosed?
Yeah, so typically any infant where there's a concern for this particular diagnosis should be promptly evaluated by a pediatric neurologist or a pediatric epileptologist. And as Dr. Glass was saying, sometimes these movements can be misdiagnosed as reflux or other more common conditions. But when that suspicion is there, and we've been raising awareness in the community so that families and pediatricians can identify this easier, quicker. The real cornerstone is seeing a pediatric neurologist and then using a video EEG. And again, that's an electroencephalogram. what that is able to do is actually look at the brain waves themselves and really characterize what this particular seizure is. Nerve cells communicate with electricity, and the electroencephalogram or EEG is going to be looking at that particularly. So that can tell us whether these movements are in fact infantile spasms, another type of seizure, or not a seizure at all. What we also look for is that video component. So we need to look at both the video and the EEG simultaneously so we can time those movements exactly to make sure that everything's lining up, because the treatments are very, very specific for this particular diagnosis. And you need somebody who's trained in reading video EEG to really be looking at this. It is a particular specialty within neurology. In addition to the seizures themselves, we're looking in between what's happening between those seizures. One of the characteristics of infantile spasms is between the seizures, the brain cells, the nerve cells themselves may not be talking the way they're supposed to. They can be disorganized, the communication is disorganized, and that's what we call a pattern hypsarrhythmia, one of those other three components of West syndrome itself. So as a pediatric neurologist that specializes in epilepsy, what I'm looking for are those events, making sure that they're seizures, in particular infantile spasms. I'm looking about what's going on in between the spasms themselves.
Very interesting. So one of the questions that I know comes up fairly regularly in our community as people are going through this diagnosis and evaluating, a lot of times, you know, our kids in particular, unlike maybe some others that, you know, IS is caused by, you know, are dealing with other, you know, medical conditions like early cerebral palsy, dystonia, things like that. And sometimes it's hard to tease out those movements. So, you know, what is the recommendation to, you know, kind of tease out and work with their practitioners to just, you know, kind of go to the next step to find out if it's something benign or something more, you know, serious like IS?
Yeah, videos are extremely important. And now that most people have a smartphone of some type, it's made diagnosis much, much easier, I feel. So my suggestion is if you see something funny, you know, once or twice, kids do funny movements, that can be it. But if it keeps happening, you know, take your phone out, take that video, because actually seeing it for your, you know, a practitioner seeing it really makes or breaks what we're going to be evaluating. So again, spasms themselves typically happen in clusters. So you're not going to miss the first, you know, if you may miss the first 1, 2, or 3, but they're going to keep happening every few seconds. And so it's one of those epilepsy syndromes where you can get your phone. You have the time to get your phone because the clusters can last 30 seconds, a minute, a few minutes.
That's really helpful. Yeah, I mean, the age of smartphones and EMR, electronic medical records and everything, definitely, I think, helps. We always encourage our families to, you know, find the best ways and ask those questions to advocate of if we need, you know, if we are concerned about a movement, how do we get a hold of you, you know, pediatric neurologist or, you know, pediatrician or developmental clinic, right? Whoever that team is. And so we've seen a lot of, you know, over the years in a much better partnership because of things like smartphones, actually. So that's really, you know, really great that, you know, we're continuing to have these tools that can help bridge that communication to get, you know, kids in. So I guess the next question, I know, Hannah, you were going to talk about kind of the STOP acronym.
Yeah, so I'll play the video again. And this is an acronym from the Child Neurology Foundation. And it's very simple, STOP. So see the signs if you recognize these clusters of movements. Take a video, as we just talked about. Talk to your doctor immediately. Obtain a diagnosis. So if there's any suspicion that this could be infantile spasms, the child needs an EEG. And then prioritize treatment. We'll be talking tomorrow about why it's important to diagnose infantile spasms and why the child needs to be seen as soon as possible by a doctor and get an EEG and treatment started as soon as possible as well.
Absolutely. There is a question that's coming in from our viewers, and it's one of our HIE moms, Ashley, who's asking, and I'm going to butcher all the medical terms, so I apologize for this, but is hypsarrhythmia only in interictal characteristic for IS, or can it appear on its own without an IS diagnosis?
Great question. Almost always you see hypsarrhythmia with infantile spasms. Hypsarrhythmia is an interictal pattern, so it's happening between the seizures themselves. And again, it's a disorganization of the way the brain activity is firing. It's also associated with what we call spike wave discharges or sharp waves. And those are basically bursts of extra electrical activity that are synchronized. And so there's a few components of it, and almost always it's associated with infantile spasms, or there's some very, very rare genetic disorders that can have a hypsarrhythmia-like appearance, not always with that particular diagnosis. After hypoxic ischemic encephalopathy, after HIE, hypsarrhythmia would really only be seen in the setting of infantile spasms. Spasms themselves can happen before hypsarrhythmia develops. So when you catch infantile spasms early, you may not see hypsarrhythmia. You may see a modified version of it. And so now that we are, trying to really emphasize education with families and at-risk populations and, diagnosis with our general practitioners, we're seeing that more and more, where we may not see the full hypsarrhythmia, but rather some variant of it, because the brain hasn't, we get closer, quicker diagnoses, and we don't give the brain enough time to develop that disorganization.
Yeah, and I think we're seeing a lot of that in our community as well, where, families will come back as we're, trying to support one another and say, hey, I went in, but the hips aren't showing up yet, but then it ends up being, they get diagnosed with IS. So we are seeing, I think, a lot of families that are getting ahead of it far more with that awareness, which is great to see. And, more things like this will help as well. A follow-up question from Ashley was, why are patients with IS more likely to develop LGS, which I will probably butcher again if I try to say it.
Yeah, no, it's a great question. We're going to be talking more about this tomorrow. But in brief, we think that these are on a spectrum. Infantile spasms, again, is this type of epilepsy that only occurs in this very specific developmental window. So it's very uncommon to have infantile spasms continue on after the age of 2. And again, there's something different about the brain during this particular period of development where you can see these epileptic spasms develop. And then in some children, especially if they don't respond to therapies, other seizure types can develop or emerge after the infantile spasms are on their way out. And that's where Lennox-Gastaut syndrome comes into play. So the reason is the spasms aren't going to last forever. As the brain grows, right, there's going to be other seizure types that can develop, right? Any child at the age of 2 is different than when they're at the age of 1. And so the brain will do different things as it develops.
Great, thank you for answering that. One last question that I've seen come through is, does the EEG need to be a 24-hour one for an IS diagnosis? And this comes from Lisa, who actually is our rep on the Infantile Spasms Action Network. So hello, Lisa, thanks for joining us.
Yeah, great question. It doesn't have to be 24 hours, but it needs to be long enough where we can capture both wakefulness and sleep. Again, infantile spasms, as Dr. Glass was mentioning, are most likely to occur during those sleep-wake transitions. And so it's critical we have an EEG during that time. And that often takes several hours, especially in the hospital setting. It can be harder to have kids sleep. So 30-minute EEGs may not give us the information we need. And every center and their resources is a little bit different. In our particular institution, we typically will admit these children in the evening and do an EEG until the next day. So we are assured that we're getting those sleep-wake transitions. We want to both, one, capture the events, right? And then two, make sure if someone doesn't have infantile spasms, be 100% sure that it isn't that. And that's where those extended EEGs can be very helpful.
Great. All right. Thank you so much for answering those questions. And thank you, everyone who's watching, for asking them. Did we miss any content for tonight that I think we went over all of the basics of.
So, yeah, I think we captured all the questions we'd planned, and look forward, if there's more questions, we'll be back to answer those and to cover some of the other topics.
Wonderful. Well, I want to thank everyone who's watching right now for attending, and for Dr. Numis and Dr. Glass for being a part of this and helping share your expertise and educating our community. We will be back on tomorrow at the same time in the same place, and talking about treatment for IS and answering questions on that. So make sure that you join us tomorrow for that. And if you miss it, it will be broadcast and the videos will be available on our public page as well for you to view afterwards. So I want to thank you both for attending and sharing all of your expertise tonight. And we will see everyone tomorrow.
Great. Thank you, Betsy.
All right.
Yeah.
Bye, everyone.
All right. Bye-bye.